Now, going
Debbie, you have a call parked at 223.
Down, that sounds
Debbie, you have a call parked at
down,
223.
directly into the carrier market. We have 3 group insurance carriers in this area. They're in the shop. Am I right? 3. Right? We have 2 of them here. So I believe there's 3, and that we'll know that later this week, maybe next week for definite. But I believe we have 3. But today we're going to start with WPS Health Insurance, a RISE Health Plan, and David Grunke is the manager of strategic accounts. And between David and Darren, the 2 gentlemen coming next, you have, I don't know, 3-4 centuries of health insurance knowledge coming at you. I was running them out.
My mother told me I should go get a hairpiece, so, my God.
So, David Grunke.
Here we go. Excellent. I'm going to talk a little bit about our exchange product. I'm not going to spend a lot of time because, as JP said, we're still in the process of filing contracts, as did everybody else, so I'm not going to give you everything that I know. I am going to tell you that WPS is on the exchange here in the state of Wisconsin. We are on both the individual exchange and that small employer shop exchange. Those are 2 different qualifications. We are here in this market. Our RISE Health Plan, which is headquartered here in De Pere, Wisconsin, operates under a health maintenance organization licensed within the state of Wisconsin. We will be expanding our geography, and you will probably see us plus or minus, and you didn't hear this from me, but 1 or 2 counties in from Lake Michigan going west, from Illinois up to Michigan. So we're probably going to cover, as I call it, the east coast of the state of Wisconsin for product in that market. Can't tell you where the prices are going to be. As I said, we're in the process. The federal government just gave us the contracts the other day to read, and our attorneys are working on it, as I'm sure yours are also. So know that you're going to have options here both for individuals and small employers. I think with that, there we go. A couple of things, and I'm going to orientate more towards the small employers in the room and kind of highlight some of the things that have gone before and some of the things that are going to happen to you. We kind of talked about that exchange notification, but if you are an employer right now, you've got to figure out your size. It's very important to know if you're plus or minus 50 based on Pepacca County. They have so different rules, as was alluded to. If you are one of those employers, you've got 35 full-time and you got a whole bunch of part-time and you want to figure it out, send me an email. My email address is on the slideshow. Put in the subject line, Pepacca Calculator. WPS has a calculator where you put in, here's your full-time employees and does a calculation. Here's your part-time employees where you put hours in, does a calculation, and says you have 48 people per Pepacca guideline. So if you're one of those companies that are in that cusp, for lack of a better term, and you want a calculator, just send me an email in the subject line, Pepacca Calculator, and either later today or sometime tomorrow, either I or one of my members of my staff will send you an Excel spreadsheet that basically is where you just input some information on full-time and part-time, and they're calculated differently, so there's 2 different ones there. So you have to know, why is it important? It used to be much more important because if you were over 50 and you didn't offer insurance, you had a penalty. That penalty has now been moved up to 2015. It's not there for 2014. That's the $2,000 penalty for not offering $3,000 for unaffordable. Now, it is interesting. I believe eligibility changes in 14, benefit levels, contribution. We don't worry about the Cadillac tax anymore. This has been delayed, but remember, the only thing that was delayed was the penalty. I don't believe all of these requirements were delayed. So it's kind of like, usually, I slept over here last night, but usually when I'm home, I usually leave home at 6:15 to 6:30, and right around the kind of circle that I live in, there's a stop sign here. And at 6:15, 6:30 in the morning, I kind of look left, look right, no joggers, no dogs, nobody on a moped. I do live in Madison. No other cars, no cops. I probably don't quite come to a complete stop there. Am I right or am I wrong in not stopping at the stop sign even though nobody has seen it? Now think back to philosophy class. Does the tree still make a noise? The fact of the matter is, I would not want to be an employer that is not in compliance with eligibility, benefit levels, and contribution levels, even though there's no penalty going forward. You're your own businesses. You pick what you want to. That's fine. Actual value calculation. This is interesting. Employers, you're going to need to know this on October 1st. I think JP alluded to it. You have to have that minimum bronze level of benefits. Here's how the federal government refers to the bronze level of benefits, and I'm sure everybody here knows this, or you know what's coming. Section 36, big B, open paren, small c, close paren, open paren, letter number 2, close paren, open paren, big C, close paren, open paren, II, close paren, of the Internal Revenue Code of 1986. Every employer, are you up on that? That's where the federal government determines whether you have at least the minimum bronze level of coverage. I'll show you a little bit later where people are going to come to you with a form and you're going to read that. That is your bronze level of coverage. So you have to know your actuarial value because your employees are going to ask you to fill forms out shortly as a result of this. Secondly, exchange notification. We've talked about exchange notification. There, you have copies there. I believe everybody should give one. It's better to give one out. Department, what is your size? Not as important, but we have guidance in there because there's a way of calculating what your safe harbor periods are. That was when the tax was 14. I don't know if that's going to be modified for 15 or not. Technically, your calculation period is still 2013. I'd assume they're going to change it to 14 at some point of time, but I don't know. Less than 50, you have to decide if you're going to play, offer coverage, federal tax credit. We've talked about that for the groups under 25, drop coverage, and you need to do a calculation. If you come from my 2-hour class, I'll have to do the calculation for you as to why the widget company either wants or wants to be out of health insurance. Here's the important part. We talked about that shop exchange. Remember, the shop exchange for 2014 was substantially reduced from what it was envisioned to be. Right now, it is the only place that you can get that tax credit that was talked about, and you're going to pick a single insurer. The design of the shop in healthcare reform was that a small employer would have the ability to offer insurance coverages to their employees like the big dogs do. So that a small employer would have an Arise plan, a Dean plan, a Prevea plan, and they'd have 5 different options there. So an employer could put 12 benefit options to their employees, and each one pick one, versus right now you kind of get one, what you pick, and some carriers allow you 2. That was going to be all done by a computer program that was going to come out of Washington, D.C., so that the employers wouldn't have to deal with the billing and things like that. That was delayed to 1/1 of 15. The shop is still important, small employer. It's the only place you can get this tax credit that's out there. So the shop is still if you're a small employer, take a look at it. Could get substantial income. The in-betweens worksheet, you can get one of those from me. Offer, pay or play, we talked about it. You have to make a decision. What is a full-time employee? Remember, it's 30 hours a week. 120 days. So depends on what your thing is. If you say I'm not offering coverage to people until they work 26 hours, you're going to have to change that, I believe, on January 1st. No penalty, but do you want to be the person out? Waiting period for coverage, no more than 90 days. When this first came out, everybody says, oh, that's great. We'll do first of the month following 90 days. Very quickly, the federal government came out with some guidance that says, no, 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 90 means 90, and there's a couple sequences of months where it'll be 91 days or 92 days. So you're probably going to be first of the month following 2 months of employment or something like that. That can't be more than 90 days. And based on some of the month sequence, you can have a 91 or a 92 in there, depends on where it is. So that was there. Part-time, we talked about that. It's total hours divided by 125. The calculation that you don't have to offer them benefits. They're only part of this calculation. Why did that happen? Remember when this first came out, talked about 50. A bunch of employers went on TV and said, ha, we're making everybody part-time so I don't have to worry about this. Well, the federal government said, that's not the spirit of the law, and we'll calculate for the spirit of the law. Benefit levels, we talked about the minimum, bronze level, essential health benefits. That could be a little bit different between small and large groups. The IRS came out in April of 13 and said, we don't expect all large groups to have all 10 of the essential health benefits. Well now, if you were my child and I said, you don't have to do all 10, they would kind of start at 1. So we don't know if 1 is okay, 9 is okay, but it's something less than 10. And I don't think we have some further guidance. The important part is, I think 9 of those, just about everybody has implemented. The one that's kind of the interesting one is adolescent, vision, and dental coverage is kind of the one that's kind of throwing the market off, and we don't know how to deal with that as insurers and provider networks and things like that. So. Contribution level, again, we talked about it's 9.5%. This is going to be important for you small employers. 9.5% premium contribution, single only. The federal government doesn't care what you charge a family unit. It's single only is what that is. But once again, a lot of small employers charge a lot for healthcare coverage with somewhat reduced benefits. So you're going to have to think about that. Confirm your group size PPO. Provide the PACA notice is what you should be thinking now. A little bit more, let's talk about this landscape. The big question is, which insurers will be on the exchange marketplace? Well, OCI helped us out. They did a press release that's in your packet August 6th. it says everybody that is on the exchange. And you'll notice that every participant here in the state of Wisconsin is operating under their HMO license other than you guys. I don't know exactly what kind of license you have, but everybody else is using their HMO license to run this. And that's another master's class as to why we picked the HMO license versus our traditional insurance license, but it is. We don't really know what geography each carrier is going to cover. We've seen in other states those networks are contracted. We may have some HMOs here that have contracted their networks. What you think is Dean Care may not be Dean Care from that standpoint. We have some that may have expanded their areas. That is the Arise Health Plan, where we actually expanded our coverage area as a result of that. So, and we still don't know that. We're probably not going to know that. Probably next week, I think things will start leaking out. Once everybody signs the contract we're on, and the press releases and things like that will come out. Remember, somebody asked the question, what's this marketplace? What's this marketplace? If you go way back to the 23rd of March when this was signed in 2010, it was called the Exchange, 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 Exchange. Everybody's going to the Exchange, everybody goes to the Exchange. They hired a marketing firm in Washington, D.C., and somebody said, the Exchange has a negative connotation with the public, so we're going to change the name to a marketplace. So use the term exchange and marketplace interchangeable. Exchange is the old name. All the new stuff coming out of the federal government, it says marketplace is on it. So those are two of the same things. You heard exchange for 2.5 years of this. All of a sudden earlier this year, I believe it was kind of branded the marketplace. So those are synonymous terms. Somebody asked that question there. How much is it going to cost? We don't know that either. OCI put out some estimates a week ago, 2 weeks ago, of what's there. We're not going to know definitely what's what and who's where on rates probably for another week or so. Remember, you're going to see on this value. You'll have a lot of people saying, well, those rates are up, but they have much more value. Why do they have much more value? Well, because, as JP alluded, you're going to have lower deductibles. I sell health plans with $25,000 deductibles. People buy $25,000 deductibles. I can't do that anymore. In the individual market, in the small group market, I can't do that anymore. Somebody says, well, clearly that person has much more value having a $2,000 deductible versus a $20,000 deductible. That person liked the premium of the $20,000 deductible. I don't charge very much. A lot of them are small business people, a lot in the agricultural market. They use their body just like the John Deere tractor. The transmission shoots craps. It's going to take $20,000 to fix it, and it's got to get fixed. My body shoots crap, it's going to take $20,000, and I got $20,000 to fix it. So you have to remember some of that mentality out there. No underwriting, as was talked about before. When I do this as a CE to insurance agents, I said, they always hate insurance companies for the underwriting and ask all those questions. I always say we've now changed the Statute of Liberty underwriting. What does it say in the Statute of Liberty? Give me your sick, your lame, and your downtrodden. Everybody is in. It's an open door. There's no questions asked from underwriting. That's a huge marketplace change in all 50 states. Rate compression, rates are going to be different by gender and age. We've just compressed those. I can no longer, up to now, I discriminated because I charge less for a 27-year-old guy than I charge for a 27-year-old female. I have a lot of actuarial statistics that say actuarially they cost more. Right now, I charge more for a 57-year-old guy than I do for a 57-year-old woman. I've got some actuarial statistics. Federal government says I can't age discriminate anymore. So those rates are going to be the same, 27-year-olds, regardless if you're male or female. From an age standpoint, the federal government has demanded age compression. Right now, insurance carriers are a 1 to 5, 1 to 6, some are 1 to 7. What does that mean? The 20-year-old policy costs $100. If you're a 1 to 5, the 60-year-old policy costs $500. Well, the federal government said, boy, that's terrible for that person to be paying $500, that one paying $1. We're going to demand a 3 to 1. And of course, I think in Washington, D.C., somebody said, well, if we demand a 3 to 1, this one's going to stay at $100, and the 60-year-old is going to go down to $300. Man, it doesn't work. So you'll see big increases in that 20 and 27-year-old category for this, and you see that coming out in some of those rates, because it's not just as simple as saying what I used to charge $500 for, I charge $300, and everything is the same. Oh, and by the way, I have no underwriting also, and oh, by the way, I don't have the sex compression that we had before. As a result of this, as JP said, there's a lot of taxes. We're putting in about 3 to 3.5% on average for additional taxes that are going to fund various parts of this. There's a reinsurance tax, there's another tax, one is 2.5%, the other is $5.35 or $5.25 per every belly button in your group, and the PCORI. So there are taxes built in it. What's changing? As we talked about, the insured market for the individual and small group are changing significantly. I don't think you're going to recognize anything on January 1st in the small group and individual market that was there on December 31st. It is going to be all different. The other thing we have is, right now, most of us as insurance companies, we got this old pool, which is the sicker people have been with us for a while, then we got that more healthier pool, and we got the open pool right now, which is the healthiest because of underwriting. Federal government says, no more different pools, we're all in one big pool. So I have to integrate with my experience some of these pools that I have that I know those are people that have been with me a long time and sick because they couldn't underwrite out, so that's why they kind of get stuck with me. So the big pool is also going to affect new business rates because all those existing legacy things are going to be in there. Individual market's going to change. We talked about rate compression. There will be non-pool rated large groups. The large group market is probably going to be relatively unchanged other than a little tweaks that are there on some of the benefit maximums that are available and certainly the tax situation. You are going to see, if you're a smaller group, all the insurance carriers are coming out with self-funded things. You're going to see companies going down to 25. I've heard we're coming out with a product that WPS goes down self-funded down to 25. I've heard other companies are in the 15 and 10. So you're going to see some new product from your agent if you're one of those under 50 groups that are out there. So that's one of the significant new things to this. You'll see some new product available out there. One of the big things is self-funded. Employers don't have to pay the 2.5% tax. So you win by 2.5 points just by doing it. Now there's a whole bunch of other things that go along with it, additional risk and everything else. It's not that easy. You'll have to figure it out. Make sure you talk to your agent, broker, or consultant on those things. Where are we going to find the products? We kind of talked about it. On exchange, now the health insurance marketplace, individuals get premium tax subsidies there. Small groups, that's where they get tax subsidies. Off exchange, there's going to be an individual market. Off exchange, there's going to be individual, small group market, and large group. Remember, no subsidies off exchange. No subsidies off exchange. So the exchange is going to be a huge value for that. When? We talked about that. Coverage is effective January 1 of 14. Enrollment period begins October 1st, as we talked about it. Employers need to get ready for the questions. In your packet, I gave you the 3 applications the federal government has out there. This is the paper form that probably is what the internet is gonna look like, plus or minus. Take a look at the blue page in there. You are going to have people coming to you saying, I need this information from you. Oh, first of all, wait, before you go, look at the first page. I shouldn't say this. Close your ears. This isn't your form, so you can probably have my form. Here's what, you guys all have employees, you have them fill out forms and everything else. What would happen to the forms you ask your employees to fill out if you gave them this sentence? If you don't have all the information we asked for, sign and submit anyway.
Is that this one? Is that
Yeah,
this packet?
yeah. Yeah, that's on the top there. It's actually the one that says family on the top is the one I'm referring to. There's 3 of them in there. It says family on the top. It's an orange one with family. All 3 of them say, if you don't have all the information, sign it and send it in. God only knows what the federal government's going to get. Oh, and also they commit to answering within 1 to 2 weeks of that. I didn't say that. Let the record reflect the audience said, yeah, right, that would be. Okay, take a look. On the first blue sheet, you have the Appendix A, healthcare coverage from jobs. It says to the person in the first line, take the employer coverage tool, which is the next page, to your employer and have them fill this out. So you, on October 1st, are going to have people coming to you, if you're an employer, with this sheet and asking them to fill it out. Here we go. This one concerns me. Employer identification number. You're going to be giving your employee, which could give it to an insurance agent, a navigator, an enrollment specialist, and everybody else that's going to be involved in this, your tax ID number as an employer. I grew up in the 60s. I saw social revolt and reform there. I don't know if I was an employer or if I would put my EIN number on a form that I don't know where it's going. I'll leave it up to you to decide what you're going to do there. Some information there. Do you have coverage? Tell us about the coverage. Take a look in number 15, the blue box 15. For the lowest cost plan, does it meet the minimum standards? Asterisk. You thought I was lying a minute ago? Take a look at the asterisk in the bottom. An employer-sponsored health plan meets the minimum standard, and there's their 3016. They don't say bronze and all that other stuff. It's there. One of the reasons why this law is so complicated, what happened in the PAPACA legislation altered the IRS rules of 1986. That's the reason why it took about 20,000 pages to understand what was in the 2,700 pages to begin with. So, as an employer, get ready and know what's going on, because you're going to have employees there. On exchange, individual, we've talked about all these things. Here's the important thing we didn't talk about. Federal premium subsidies. Small employers, you may have, and you're going to say, boy, this is really great, I offer coverage to my employees. You may have a groundswell of your employees saying, I don't want coverage from you anymore, because they're going to get substantial federal premium subsidies. 400% of poverty. Family of four, 400% of poverty is about $96,000. So those people will get money from the federal government to have premium. Secondly, if they're at 250% of poverty or less, there's additional federal government cost sharing to help them with their deductibles, co-insurance, and co-pays that's embedded in there. So if you employ people whose family income is less than 250% of poverty, you may have, as an employer, your employee is having a mini revolt against you saying, I don't want this, you charge me a lot, not as good of benefits, I can go here between subsidies, get a much better deal. Be prepared for that, Mr. Employer. That's going to start October 1st. And if your employee doesn't do it, when they go to bridge at church and Mildred's talking about it, they're going to, Mildred's always an expert, and they're going to come back and Mildred said, and you're going to have those type of things going on. So know what it is. Increased benefits. We've talked about these different plans. Remember this, the bronze, silver, and gold, as was said before, isn't quality. It doesn't really have to do with some premiums either. It really has to do with trying to make healthcare benefits looks like the milk counter over at Festival Foods here. Skim, 1%, 2%, and homogenized. So they're all going to be there, and they could have a different price. Skim, there's somebody that charges $3 for skims, some charges $3.10, somebody charges $3 1/4, and some charges $3.50 for skim. People buy all of them. Individual off exchange. If we're on the exchange, we have to have identical twin products with the exact same thing, and that's kind of the end of it.
When the employee comes back and says, I can get it for cheaper getting out of your plan, and they say, but I want you to pay for the premium, the lower premium, blah, blah, blah. How are we supposed to handle that?
Oh, am I glad you asked the question. The answer is no, unless you are an employee of the United States Congress. The 11,000 employees that are our state representatives, our state senators, and their support staff, their employer, the federal government, is actually giving them an employer subsidy because it says they have to buy coverage on the exchange. So only they can do it. You cannot give anybody money to buy health insurance on the exchange. Now that doesn't mean you don't get out, and it's the calculation if you come for the 2-hour show, that the widget company, you can say, well, I'm getting out of health insurance, I'm going to give everybody a $200 raise. Now you're not giving them money for insurance. So, there's some ways about it, but you can't directly say, I used to pay this for you for single and that for family, and I'm going to give you the $10,000 subsidy for family and $4,000 for single like the federal government did to the congressional employees.